Shock occurs when the cardiovascular system fails to deliver enough oxygen and nutrients out to body cells to meet their metabolic needs. There are many different causes of shock, but they all have the same characteristic: inadequate blood flow to body tissues. So when body tissues don't get enough oxygen, cells are going to go from aerobic respiration to anaerobic production of ATP. Now remember back from when you learned this in your ANP1 class. When you have anaerobic production of ATP, that means there's not enough oxygen available for aerobic production, right? So what happens? Your cells start to build up lactic acid. That lactic acid then is going to accumulate in body fluids and wreak havoc on body pH, right? So if shock persists, cells and organs are going to become damaged, and cells may die unless treatment begins quickly. So shock can be one of 4 different types: hypovolemic, due to decreased blood volume; cardiogenic, due to poor heart function; cardiovascular, because of inappropriate vasodilation; or obstructive shock, where something is blocking or obstructing blood flow. So a common cause of hypovolemic shock is sudden hemorrhage. Blood loss may be external, such as what happens when you're in an accident or you have some sort of trauma, or internal. If you have a rupture of an aortic aneurysm, then you're losing blood internally. Loss of body fluids, whether it's through excess sweating, diarrhea, or vomiting, can cause hypovolemic shock. Diabetes mellitus can cause excess fluid loss in the urine. Sometimes hypovolemic shock is you just simply are not taking in enough liquids, but whatever the cause, the volume of body fluid falls, venous return to the heart declines, filling of the heart lessens, excuse me, stroke volume decreases, cardiac output decreases. So body tissues are not getting enough blood. So replacing fluid volume quickly is essential in managing hypovolemic shock. If blood volume is low, get the volume back up. In cardiogenic shock, the heart pumps inadequately. This is most often caused by a heart attack or a myocardial infarction. Other causes of cardiogenic shock can include poor perfusion of the heart. So if you have a blockage and the heart is getting not enough oxygen, a condition we call ischemia. Heart valve problems, excess preload or afterload, impaired contractility of the heart muscles, or arrhythmias. But even with normal blood volume and normal cardiac output, shock can still occur if blood pressure drops too low because you have a decrease in systemic vascular resistance, right? So a variety of conditions can cause that inappropriate dilation of the arterioles. Anaphylactic shock, which is a severe allergic reaction, say you get a bee sting, that causes a major release of histamine. And histamine and other chemicals that are released as a part of that allergic response cause very rapid vasodilation. Vasodilation, loss of blood pressure. In neurogenic shock, vasodilation can occur following trauma to the head, and that, of course, is going to cause a malfunction of the cardiovascular system in the medulla. Shock stemming from certain types of toxins that produce vasodilation is termed septic shock. In the U.S., septic shock causes about 100,000 deaths per year and is the most common cause of death in some of hospital critical care units. Obstructive shock occurs when blood flow through a portion of the circulation is blocked. So one of the most common causes of this is a pulmonary embolism, where a blood clot becomes lodged in a blood vessel of the lungs. Fortunately, the body has major mechanisms of compensation in shock, and those are the negative feedback systems that work to return cardiac output and arterial blood pressure back to normal. So the first way that we want to consider in this that our body compensates for shock is to activate the renin-angiotensin-aldosterone system. So when there's decreased blood flow to the kidneys, remember, they're going to secrete renin. that's going to initiate the renin-angiotensin-aldosterone system. Now, we learned back quite some time ago that angiotensin causes vasoconstriction, but remember, it also causes the adrenal cortex to release aldosterone. Aldosterone is that hormone that travels right back to the kidney, causes sodium-potassium pumps to be built so that we resorb sodium back into the blood. When we resorb sodium, water follows. That's going to increase the blood volume and, of course, raise blood pressure. That increase, when the angiotensin causes the vasoconstriction, that, of course, is going to raise blood pressure by increasing the peripheral resistance in those arteries. The second mechanism is the secretion of antidiuretic hormone. So when blood pressure falls, the posterior pituitary releases more ADH. ADH targets the kidneys and pokes water porins, right? Aquaporins, water holes in the little filtration tubes. When you poke water holes in those filtration tubes, water leaks out, so it doesn't end up in the toilet. It gets resorbed back into the blood, and that helps to increase blood volume. If you increase volume, you increase pressure. It also, remember, ADH, when it's released in high levels, is called vasopressin because it causes vasoconstriction, and that, of course, increases the resistance. The third mechanism to compensate for shock is the activation of the sympathetic nervous system. So as blood pressure decreases, those baroreceptors that we talked about in the aorta and the carotid artery are going to initiate responses throughout the body. So one, they're going to cause vasoconstriction of arterioles and veins in the skin and the kidneys and the viscera. Constriction of the arteries in the systemic increase your vascular resistance. Constriction of the veins in the venous return is going to increase venous return. So we're increasing that pressure by pushing more blood back in the venous return and increasing the pressure by constricting the arterioles. Both of these are going to help maintain an adequate blood pressure. Sympathetic nervous system, though, remember, also is going to stimulate an increase in heart rate and contractility because it's going to cause the adrenal medulla to release more epi and norepi. So these are going to increase heart rate and contractility, but also cause vasoconstriction. And all of that leads to an increase in blood pressure. And then the fourth mechanism that is activated in response to shock or in response to hypoxia, low oxygen, is that the cells of the body are going to release vasodilators, such as potassium and hydrogen ions, lactic acid and nitric oxide. These are all going to dilate arteries and relax precapillary sphincters. This vasodilation increases local blood flow and can help restore oxygen back to normal in that particular part of the body. This figure shows those homeostatic mechanisms that we just talked about that can compensate for blood loss for as much as 10% of total blood volume. So hypovolemic shock, low blood volume, remember, is going to disrupt blood volume and blood pressure. So what happens? Our baroreceptors detect that and activate the renin-angiotensin-aldosterone pathway that begins with the liver and the lungs, converting that angiotensin in the blood. Then that's going to cause the adrenal gland to release aldosterone. That's going to target the kidneys, which will retain sodium and water and increase blood volume, right? That increases blood pressure. But also what happens here, my clock just popped up there. Also what happens when those baroreceptors are stimulated, the medulla, the cardiovascular system, is going to send out sympathetic nerve impulses that are going to cause vasodilation and increase heart rate. That's going to increase the vascular resistance and increase cardiac output. That's going to increase blood pressure. The hypothalamus and the posterior pituitary releases ADH. ADH is going to cause vasoconstriction. It's going to cause the kidneys to retain water. When water is retained, we increase blood volume, we increase blood pressure, and homeostasis gets back to normal, and negative feedback shuts this system down. Even though the signs and symptoms of shock can vary according to the severity of the condition, most of those signs and symptoms are pretty predictable if you think about the responses that are generated by the negative feedback systems of the body that are trying to correct the problem. So let's look at some of these. Cool skin, pale, clammy, due to the sympathetic constriction of blood vessels near the skin, and the sympathetic nervous system stimulating sweating. Resting heart rate is rapid because the sympathetic nervous system is causing epi and norepi to be secreted. So that's going to cause the heart to beat faster. The pulse is weak and rapid due to reduced cardiac output and faster heart rate. I've already mentioned the skin and the blood vessel, or the constriction of the blood vessels in the skin, so the skin becomes cold and clammy and we sweat more. Systolic blood pressure is lower than 90 millimeters of mercury. Well, that's one of the obvious signs, right? Mental state may be altered because of reduced oxygen supply to the brain. Urine formation is reduced due to the increased levels of aldosterone and ADH, causing us to retain water. The person's usually thirsty due to the loss of extracellular fluid. The pH is low, so acidosis develops due to a buildup of lactic acid. And the person may also have nausea because of the impaired blood flow to the digestive systems because of that sympathetic vasoconstriction. So if you think about what the body's trying to do to correct shock, it can explain a lot of the signs and symptoms that are the classic things you look for with shock.